Hello, my name is Dr. Tabrizi, and I'm a geriatric dentist. The age-friendly health system and the 4Ms framework demands a person-centered, customized healthcare plan for individuals aged 65 and older, with the best possible clinical outcome according to individual satisfaction and what matters most to them. This system of care is practical and clinically applicable. However, the satisfying outcome depends on how comprehensively what matters is considered for the individual's care plan. A plan that considers every aspect of health that matters and impacts the health and the quality of life of older adults, and oral health is no exception. The purpose of this video is to introduce non-dental health providers to oral health assessment guideline. It would incorporate oral condition at the check history for baseline on 4Ms in both hospital and primary care workflow. The guideline is a modification of original Kaiser-Jones brief oral health status examination, also known as BOHES, for dental professional, which is consisted of 10 comprehensive categories. This modification, with only 6 categories, allows oral assessment for non-dental providers with the intention of integrating a visual assessment on oral health condition at the 4Ms baseline. So we start with visual assessment. The first thing is just to make sure for symmetric in both sides of a neck and a face. The symmetry is a condition, that there is no abnormalities. And then we start by asking questions. Is anything unusual you have seen in your mouth or neck or anything lately? And usually patients will respond to you if they are communicable. And then we go to the palpation. Just gently but thoroughly feeling the nodes, the lymph nodes, and all around in the chin. Turn to your left. Checking the lips, inside the lips for any nodules, anything unusual, anything that feels different. And that's the first category. There are 6 in this section. And then we look at looking for oral cancer screening. Oral cancer screening is nothing but a visual, comprehensive look. First, again, exterior. And then we start looking inside the mouth. Looking at pulling the lower lip. Looking inside the cheeks. Roll up. Inside the upper lip. Looking for any lesions, anything bumpy. Then I'm going to ask the patient to look at the tongue. Put your tongue on this gauze. There you go. Very good. And then I roll the tongue back, looking the base of the tongue on both sides. And I look at the dorsal of the tongue. Now I go floor of the mouth. It's just observation. Looking for any discoloration, looking for anything that it's not normal. It's different. And then we check for the saliva. Saliva needs to be not thickened, not bubbly, because when saliva is thick, that means patient is at high risk for caries, because thick saliva changes the pH into acidic. So you check the saliva just by looking at, I'm going to use a tongue blade. It's very easy to check the quality of saliva. Put the tongue blade over the tongue. If it sticks, which in his case it does, that means he has dry mouth. Looking at the lips are very dry. So definitely dry mouth or xerostomia is a condition here. The next category that we have to consider is the condition of teeth and the gums. I look at the teeth just visually, assessing. The teeth, I see these clasps here. So he is definitely wearing removable teeth. And you can see that there is a lower partial. And then I look at the top teeth, just touching, it's more feels like acrylic. It's not touching the natural gum. So he is definitely dropping. We have 2 removable prostheses here on the lower and the top. He has a few natural teeth of his own natural teeth. But when you look at the gums, natural gums, they look pink. They're not reddish, they're not swelling. I don't see bleeding. So the gums are fairly healthy. But the fact that he's missing all the top teeth and most of the lower teeth, we know that he has a few natural teeth and 2 prostheses, top and bottom, which led us to the next condition that you want to ask if they are comfortable and if he can chew comfortably, which is the function. The function, we want the best optimum function for a person to chew. You can close if you want. To chew is to have at least, whether natural teeth or artificial teeth, they need to have at least 7 teeth, top and bottom, in contact so the function of chewing can take place. And in his case, he definitely is functional, even though he's missing a lot of natural teeth, but his removable prosthesis has replaced them and he can bite down. He can definitely, plenty of chewing function there. And this is a total assessment following the 6 category of Bohe's, and this can easily be as a part of a 4M's baseline.